Good morning, everyone, and welcome to the Wellness and Health Promotion Podcast. I'm Heidi Tanner, the Director of Wellness and Health Promotion at Hartwick, and your host. This podcast serves to make our Hartwick Campus Community aware of current health and wellness initiatives and issues facing us today. For each series, we will invite different guests from campus to share their experiences and knowledge. No two casts will ever be alike. Our first series is the COVID Chronicles, and the mission is to connect you with real people who are front facing to this pandemic on campus. Today, in episode 1 of the COVID Chronicles, we will focus our attention on what Hartwick students need to know. We will dive into what you can expect if you have to be quarantined or isolated, and we will hear how to make it through one day at a time. I would like to introduce my two guests, Amy Gardner and Cam Strang. Amy is the director of the Perella Health Center, and she is also a family nurse practitioner. She is certified to work with patients of all ages and across all various specialties, including the college population, and we're really lucky to have her. Cam Strang is a valued member of the Hartwick College Peer Health Education Team, which serves to provide preventative health education for Hartwick students through creative programming. Welcome. It is wonderful to have you both here today. I would like to give you each a moment to further introduce yourselves, and we, your audience, would love to learn one interesting thing about each of you. Amy, you get to go first.
Hello. So my name's Amy Gardner, and I'm an alum of Hartwick College. I graduated in 1999, and I think it's important to know I started my career out in long-term care, working in nursing homes, and then transitioned to working here at the college. But I thoroughly enjoy it. I find that everything that I learned in long-term care applies here. And I come at care from a philosophy that caring for people, providing medical care and services for people can't happen unless you care about them first.
Oh, that's great. We're so lucky to have you here. And I think that's such a great mentality. And it really goes along with everything we at the Health Promotion and Wellness Office agree with too. So Cameron, tell us a little bit about yourself.
So I'm Cam. I'm a junior sociology major, and I'm a brother of Alpha Sigma Phi. I started with the peer health education program this year, and I really love it. I think it's really important, and it's a really fun way to be able to kind of spread important messages, about not only self-care, but physical care, and just a way for me as a student to help out other students and kind of have a platform to speak on. One interesting fact about me is I have two small dogs, and they're pretty loud, but I love them.
Awesome. And I'm sure they've been really helpful during this pandemic to keep you keep you healthy and well.
Absolutely.
Excellent. Well, today we are talking about what our students need to know in regards to COVID. And I really want to dig in and start with this idea of isolation and quarantine. So, Amy, can you give us an overview of what would happen if a student tests positive and has to be isolated? What does that look like from start to finish?
Sure. So once an individual is tested and the results come back, those results go back to a variety of people. So they go to the local health department, they go to that student's ordering provider, and they go to the student. So any one of those people may see the result first and be making an initial reach out. Here at Hartwick, especially once we start our on-campus testing, those results will be coming back here to the health center. And more than likely, it will be myself or one of my staff who does the initial reach out to you.
Okay.
Although Hartwick isn't doing our own contact tracing per se officially, in order to keep our campus as safe as possible, one of the strategies is that you need to be very efficient in identifying people who are positive in their contacts,
Okay.
and found that we're able to actually get out ahead of the local health department completing that process.
Okay, so let's talk about that for a minute. Thinking of being, in a sense, sort of mortified that I could have unknowingly passed COVID on. What is sort of from both of you, Cam, I'm going to jump to you first. Was it hard for you to be honest about people that you had hung around with or been around with when you found out that you had tested positive?
Um, well, I think the very first thing that comes to mind when knowing that you have COVID or testing positive is panic. First is panic just because it's such a scary, confusing thing, and a lot of us have never been through something like this before. But I would say weirdly enough, it makes you feel kind of guilty
Mm-hmm.
having to reach out to people and saying, hey, and just, feeling bad that you may have put them in a compromising position, I guess.
Mm-hmm. Definitely. And yet it's so important that we do that, that nobody's really going to get in trouble per se. It's just that, we'd hate to think of like you said, putting anyone in harm's way in any way, shape, or form. So I think sort of the takeaway here that I'm going to glean from this, and you two can correct me if I'm wrong, is that it's really important at that initial outreach that if it's the Department of Health, if it's the Perella Health Center, that you're truly honest with anyone that you've been in contact with so that you can protect our campus community as a whole. Any other comments on that from from either of you?
Yeah, I would agree that it is critically important that you share any context that you can think of. We're going to ask you some leading questions to try to, trigger your mind about people you've been around, places you've been. Um, and know that just because you name somebody, um, that doesn't necessarily guarantee that they're going to be placed in quarantine or that they've been infected. There are a lot of very complex criteria that play into who gets placed into quarantine.
Okay.
Um, but knowing who those contacts are gives us the opportunity to then sort those scenarios out and make sure that we're doing the best we can for everyone who's involved.
Yeah, that's I think really important to also just sort of reiterate is that, like you said, just because you are near someone doesn't mean you're necessarily going to have to go into quarantine, that there are those sort of indicators. Do you have an indicator that, that's like sort of pretty sort of like a really good working definition of something that students could consider? Like I've heard, for example, that it's if you are sort of front facing for at least 15 minutes. Is it less than 6 feet? Do you have to have the mask on, off? Is there anything you can comment? I know it's very different in individual, but anything in that context, Amy, that you can comment about?
Yeah. So the working criteria are if you are within 6 feet of an infected individual or in an enclosed space with that individual for a cumulative time of 15 minutes or more. More than likely, that is going to result in you being quarantined because that lower distance, confined space, or extended time are three of the factors that increase the risk that the virus will be transmitted.
Gotcha.
And within those factors, unfortunately, at this point in time, it does not matter whether masks were on or masks weren't on, um, because there's a higher risk in those scenarios. Still completely encourage people to wear their masks all the time. That does help to lower the risk. But because that risk exists in those scienarios, there is almost a guarantee
Got it.
that
So,
it's will be quarantined.
so if Cam and I are in the same room and we're talking, we have our masks on, and one of us tests positive, we're both going to be, in a sense, I'm going to be quarantined. Let's say Cam tested positive, he's going to be isolated. And all that really does, really for me, is it has reduced my risk. I may not show any symptoms. I may not have caught it, but to be safe, I'm going to have to go in quarantine anyway.
That's correct.
Great. So let's paint this picture. It's 8 o'clock at night and the test results come in and a student in a residence on our campus has tested positive, and the initial phone call, let's see, has been made from the health center. What's the next step? What could that student expect if they had to go into isolation, Amy?
So that student should be expect that they're going to be asked to pack up all of the personal belongings that they will need, including linens, towels, pillows, blankets, for the next 10 days.
Okay.
And they should expect that they're going to be assigned to either one of our on campus isolation housing spaces, or if they live within 3 hours or less of the campus, um, ask if it's at all possible for them to return home. They should expect to work with the individual who's calling them to determine where the best place is for them to isolate, whether that's returning home or whether that's using one of our campus isolation spaces.
Okay.
And then be prepared that they're going to be moving out of their current space. And although it, seems really difficult, they should anticipate that this process is going to happen very quickly.
Okay.
Um, you don't get 3 hours to pack up and move. Typically, you're going to be moving out of your space within about an hour.
Okay. And I think that's really important to know. And that again is for that student's safety, and that is for the campus health and well-being. Not because people are trying to be not compassionate. It's the nature of the COVID beast, would you say? Um, any other comments on that sort of fast turnaround? Cam, how was that for you?
Yeah, so I tested positive for COVID on October 30th. I got tested on the 28th. However, I was fairly certain that my test was going to become positive. So um, what I did after I got tested, I went back to my room. I packed up again all the things that I thought I would need for the time I would be spending away from my room. And I made a phone call, and I was actually fortunate enough where I live within 3 hours from the school, and I live with my mom, and she was able to make arrangements to be able to stay somewhere else. So pending those results, I went home to start quarantining. And, it was a good thing that I did that because I did end up being positive. So I was already in a safe place for me to quarantine alone, and just, away from the general crowd that I could get sick potentially. So um, I like to think that I was trying to play it safe, and it worked out for me.
It sounds like you did. It sounds like you did a really good job too. So how did you feel? What was that feeling that you felt after you went and got the test done and as you packed up your room? What was kind of going through your mind there, Cam?
Well, the first thing that came to my mind was relief. Just knowing that I got the test, and now my information will be in the system, whatever way it turns out. So it was a bit of relief, kind of going from an area where, like, oh my gosh, I could be sick. Like, what do I do? And the first step is to go get tested and, prepare for the situation you're about to be in. Um, I got a little bit of time to pack up my things, make sure I had everything I needed. And it was nice also being able to call home and knowing that there was a spot for me to safely quarantine.
Hmm.
So I think that really helped out on the initial anxiety that comes with testing positive or thinking that you might test positive.
Thank you for sharing that. So let's talk about that a little bit. I think we all kind of really do know the difference between isolation and quarantine. However, I know that sometimes we use those words interchangeably. So we know that if someone tests positive, they have to go in isolation. However, if you were around someone that tested positive, you would have to go into quarantine. Amy, can you tell us a little bit more, like a little bit more about the differences between the two?
Yeah, so it really at this point has become much more a matter of semantics than broad differences. With both, the expectation is that you are separating yourself from all others, staying within your home or living space, not interacting, again, if you do go home with your other family members, to decrease, if you're positive, the risk of getting them sick. There used to be some differences in time frames, but those have now been reconciled. So both time frames are now 10 days.
Okay.
And the the process for ending isolation or quarantine is where I see the biggest difference at this point.
Okay.
um, Quarantine ends 10 days after you were able to fully separate from whoever it was that was positive, as long as you haven't developed any symptoms. And at Hartwick, we use midnight on the last day of your quarantine as the time that you're released. So if you're in quarantine today until midnight, you can return to your living space and campus activities the next morning.
Okay.
Um, for isolation to end, you have to complete that full 10-day period. You also have to be completely symptom free for 72 hours before the isolation period ends. So if you get to the 10th day, but you're still having a cough or a stuffy nose or fevers, your isolation period does not end. It continues.
Okay.
The other difference that people will see is in the way that they're contacted through the public health officials. Um,
Yes.
People in isolation will be receiving typically a daily direct phone call contact verifying that they are indeed following all the rules of isolation, which will get sent to them an electronic document that they're not having any severe symptoms, and that they don't have any needs that aren't being met.
Mm-hmm.
um, with the escalating numbers, individuals in quarantine are not getting that direct human contact. They may get an initial reach out from one of the contact tracers, but after that, their either email or cell phone text number is put into an electronic system,
Okay.
which generates a notification daily. And if they want to speak to somebody or have a need or a question, um, through one of the public health officials, they respond to that and then they get a call.
Okay.
Um, Here at Hartwick, we have a quarantine team that's working with individuals. And so within the first day or so of being in isolation or quarantine, you, there'll be an outreach from a Hartwick staff member, and that person can kind of become the go-to for students for any questions, concerns, needs that they have, other than direct health related needs, in which case they would follow up here at the health center with a call or an email.
Excellent. I think that's really important, that we took a moment to share that with people. So Cam, you mentioned the other day that phone call was really meaningful to you. Can you talk to us a little bit about how that impacted you in your situation?
Yeah, absolutely. So every day I would get a phone call from somebody from the Department of Health. It was the same person every day. She was very nice. She was always there to answer my questions, make sure I was doing okay. And it was really like a comfortable relationship.
Mm-hmm.
Basically, like, if for some reason I miss a call, like I was in the shower or something, same number, call right back, and they answer within 2 rings. Very nice about it. They'll leave you a message. If you have any concerns or anything, they'll listen to you. They'll hear you out. So it was something that really made having to go through those 10 days alone. It made it very more comfortable. It was something to almost even look forward to every day, the daily phone call from the Department of Health.
Nice. Like you're getting through. It was going to be coming to an end sooner than later. So that's good. And I
Maybe,
feel, yeah, go ahead. Go ahead,
I'm sorry,
Amy.
let me just add in there that it
Sure.
is critically important that people do respond to that phone call coming from the Department of Health, because that initial contact generates information that allows for the document to be created at the end of the process for people to be released.
Okay.
And that release document is a requirement, again, to go back into doing daily activities. So if the Department of Health has been reaching out to you and you don't answer their phone, you don't return their call, they will not generate your release document until they make direct contact with you. And it can actually prolong the time that you're in isolation or quarantine, even though your symptoms have resolved.
Excellent point. Really good point. And I was going to say too, shouting out to our audience, moving through J-term and the spring semester, if you know someone, if you know a student, if you know a faculty or staff member who's had to be quarantined, we've heard it here from both Amy and Cam how important just some daily contact is. And if you have a great working relationship with that person, make sure that you reach out while they're in that state. I'm sure they would be happy to hear from you and know that you are thinking about them. And as we think about overall health and wellness, it's so important for all of us to feel connected, especially during this extra crazy time. So I just wanted to talk for a few minutes because I always think it's helpful to have scenarios. But let's talk about scenarios that if our students, if our Hartwick students find themselves within, we know they would, and someone within that sort of scenario or group tests positive, that they will automatically go and be placed into quarantine. So what are some of those scenarios, Amy, that you've seen from your perspective where students would have to most definitely go into quarantine?
So an almost guarantee would be riding in a vehicle
Okay.
for any length of time, 50, even less than 15 minutes with an individual who tests positive, regardless of if masks were on or off.
Okay.
Being in the confines of a residence hall room, essentially for any significant length of time. And one that people don't tend to think about as much, but sharing a meal.
Okay.
Within a close confines.
Yes.
So going out to eat at a restaurant, eating in for fast food, eating fast food together within a dorm room. Those are all considered to be higher risk activities. And likely those are going to be guarantees if someone within that circle tests positive, that all the others will be placed into quarantine.
Excellent. Thank you for that. So Cameron, you went home when you knew and you had that hunch that you were going to test positive. You went home because you live less than 3 hours away from school. Tell us sort of what you did to safely isolate and what were your biggest concerns at the time?
Well, I have to say I was pretty fortunate in the sense that my symptoms weren't that bad. So I lost my sense of taste and my sense of smell. But other than that, I was pretty healthy. So I was able to, one of the things that really helped me get through my quarantine stage is just trying to take care of myself. I was exercising. I wasn't really trying to push myself too hard by any means, but, just staying in shape, being mindful of what I was putting into my body. I took full advantage of not being able to taste and ate salads like every day.
Love it.
Yeah. And, again, being home, it was nice that I could step outside, get some fresh air, which I know is an advantage that people who would be quarantining or isolating on campus won't really get as much. But it was helpful for me. And, if you get that opportunity, definitely take it. I mean, you're going to be cooped up and the least you could do is get some fresh air.
Right.
I
So
think
let's
that
talk
helped.
about that. Yeah. I mean, the Department of Health, if you talk to them and you are quarantining at home, you absolutely are encouraged to go outside of your space and to take advantage of that. So, Amy, we know that that's not the same if we have to isolate at Hartwick. So, can you speak to that a little bit?
Yeah. So, when you're at home where you can go through, an exit where no other people are going. You kind of exit your house through a non-common space is what they call it. Out into your own backyard where you're not going to encounter anyone. That is considered reasonably safe. Unfortunately, all of our isolation and quarantine spaces here on campus, in order to exit them and get time outside, you have to pass through a common space. And so that makes one of the advantages of going home that opportunity to do that. But here on campus, once you are placed into an isolation or quarantine room, the only time that you can be out of that actual space is to use the restroom, the shower facility, and then you need to return right back into your space. You're not allowed to, be out and about in the hall. You're not able to be in the stairwells. And unfortunately, you're not able to step outside, go for a walk, get fresh air. Um,
Yeah,
so, as Cam said, if you can talk to whoever's calling you about making a return home to complete your isolation or quarantine safe,
hmm,
for those that would be around you, you definitely get some additional comforts. If not, we've learned a lot from the fall semester, and we've definitely, crafted our isolation and quarantine. We've made significant improvements, but there really is no place like home,
true.
especially when you're not feeling your best or when you have to spend, a significant amount of time not interacting with people.
True. I like what you said. We have learned a lot. And one thing that I want to mention to students right now, as we come into this preliminary sort of 4-day precautionary quarantine, is that student experience has worked really hard to create some what we are calling fabulous quarantine kits, from some DIY craft kits to how to journal kits, some like facial supplies, even fitness supplies such as yoga mats, uh, rubber bands, the tubing bands for fitness. So you can request one of those types of kits to kind of help you get through this initial quarantine time. So I think, one of the things that we know is that, we're all sort of in a sense being forced to grow right now through COVID, whether we wanted to or not. It's what strong people do, and we're all trying to figure that out in our own way. And so, getting creative in your small space is such a great way to build your own personal resilience. And I appreciate you both kind of sharing the things that you have learned through both of your sides of the equation experience here. So, when you both think about sending students into quarantine and isolation, and Cam having been in quarantine or in isolation, what are some of your suggestions to help a student? You know, we hope that no one has to go into quarantine and isolation. However, COVID is still a risk. So we know that regardless of what we do, there's still that risk. We're going to do all that we can, wear our masks, wash our hands, socially distance, and be mindful. However, what's that sort of like? I think of it as like, for lack of better terminology, I remember being pregnant and being prepared to go to the hospital, or and being able to leave at a moment's notice. What are your suggestions to students to sort of be prepared for a possible quarantine? What are some tips or things that you would tell them to consider? Amy, why don't you go first?
Um, so as much as we don't want people to be worried or anxious over it, I encourage everyone to, just sit down, reflect, take a piece of paper the old fashioned way, or make notes in your electronic device if you want to do it in a technological way, and make a list of the things that if you were told to leave your space on short notice, that you would want to take with you. So that you can consult that list and kind of check off, do you have everything? And I, think about things like medications, chargers, extra batteries, headphones. But also, if you're a person who likes a particular brand of snack or
Mm-hmm.
only drinks a particular, flavor of tea, making sure that you have those things available and on hand, so that you can take them with you to make your new home away from home for that period of time comfortable to you.
I like it. Cam, what do you suggest?
I just gotta say, I love that idea by Amy. Just making sure that you're gonna have not only what you need, but what you're gonna want, like something that's gonna help you pass the time.
Mm-hmm.
Um, and I know we talked about not being able to go outside. I think a really good tip that I used to use when I was sick last year, if you don't want to leave your room or you can't leave your room, maybe just have your window open. And I know it's cold, maybe just 10 minutes, just get out all that stale air, have some nice fresh air for yourself. Um, just find something to do. Take that opportunity to better yourself if you can. If there's any work that you have, maybe use it to catch up. I mean, you might as well. You don't have much else to do.
Good. Great words of wisdom. And we love to hear that on a college campus.
So, and I
Definitely.
have to say, in my personal, heaven forbid I ever have to, go into quarantine or isolate. Um, but I have a book tucked away. It's the book I've been dying to read forever and can never find the time.
That's
Um,
awesome.
but it's in my pile of stuff, so it can go with me wherever I go. It's the little things that truly will help you get through this process.
Right. And I think too that sort of ability to stop. I always like to say this, but it's my stop, breathe, listen, and respond after that, in a sense, like you both have said, don't panic. It's nothing to be anxious about, but just, knowing in a sense, like can you take a moment and look at sort of what the sort of positive can be from the experience. And like you said, Cam, catch up on your work, read a great book that you haven't had a chance to read. What's that show that you've wanted to kind of dig into, or project that maybe you want to spend a little more time on? So excellent choices. As the health promotion person, I highly recommend and give you 2 thumbs up for those suggestions. So Cam, what really helped keep you going when you were isolated? What were some of those things that just really, like, you were able to uh, stay somewhat, it sounds optimistic and positive, and what was that really helped you do that?
Well, as funny as it sounds, doing things I really hated to do. Like, for
So
example,
please
um,
explain.
making sure the dogs are always fed, always cleaned up, always taken care of, staying on top of the dishes, making sure the house was clean. As much as I hate doing that kind of stuff, it really helps take your mind. You spend an hour doing that stuff, and it's like an hour that whizzed right by, you can't even account for.
I like it.
So, just keeping up with stuff that you don't want to do. It's just one way to burn some time, I guess.
I like it. I like to call some of those things energy sucks. And sometimes I'll make a list of things where I'm like, this is totally, by me not getting it done, it kind of is sucking away some positive energy too. And I sometimes find that if I can tackle that list a little bit, even 1 or 2 things, I definitely feel much better at the end of that moment in that day. Amy, based on all the students that you have assisted and guided through this, have you heard sort of any other things that have really helped students make it through quarantine or isolation?
I think it's being having knowledge,
Okay.
um, reaching out when they have questions, talking through when they're feeling nervous or worried about something, whether that be medical health related, reaching out to here to the health center, whether that be concerns with their faculty, reaching out to them. Um, we as a campus, we're all in this together. Our goal is for everybody to be successful. But unfortunately, because we're all separated, it's really hard to know what people are thinking and feeling and what's worrisome or bothersome to them. Um, so if you reach out to whoever it is you feel most comfortable reaching out to, if something is bothering you, they can get you connected to the right resource, and we can help to resolve the issue as best we can. We might not be able to always make something perfect, but if you're having a concern and we don't know about it, it can continue to drag you down. If you're having a concern, more than likely, either we haven't thought about it and we can and develop a solution, or somebody else has already experienced it and we have a workable solution. We just need to know to offer it. And that can be something from, as simple as I ran out of toothpaste. Oh my goodness, what do I do? Um, or as complex as, I have a really big test and I just, haven't been feeling able to do my work. I'm having symptoms and I'm sick.
Mm-hmm. Mm-hmm.
Um, but we won't know that unless you reach out to somebody and allow us the opportunity to help you, to
Absolutely.
truly care about you.
We do. We do. And I think I would just like to tack in on that too. COVID is new. It's a new virus. We're trying to stay a step ahead of it. However, it evolves like it's going to evolve, and good communication is critical. We need to hear from you as students, as faculty, as staff, and we all need to, I think, recognize that it's important to let us all work through this with grace, that we're all trying to do the best that we can with what we have. And we do, like you said, Amy, everyone's success impacts everyone else's success. We want to have successful students and successful staff and a successful health center. That's how Hartwick College works. We really are one WIC, so to speak. So as we close this episode with the two of you, are there any other words of wisdom or little tenets that you want to leave our listeners with in regards to J-term and COVID and kind of all of us coming back together? Anything that you feel is like your sort of uh, an important set of parting words before we go into our mental health moment? Cam, what do you have for us today?
Not to sound like a broken record, but coming from a student, it really is important to just, get in contact with your teachers, get in contact with Perella. They really are just here to help you. I know when I had COVID, all my teachers were so awesome, asking me if I needed extension. I mean, I felt fine enough to do all my work and I didn't really need anything like that, but
Mm-hmm.
they were really good about trying to accommodate for the fact that I was off campus and I was going through something different.
Mm-hmm.
So just talk to everybody and they will try to help you.
Excellent. I like that. And that we get it, as in a sense, for lack of a better word, the adults on campus, we get it. It's a struggle and we do want to help. So I think those are great words of wisdom. Amy, what do you have for us today?
So everything about COVID is new, unique, and tends to be an inconvenience. Um, but those inconveniences, especially those that are being imposed by the college, have had hours of time put into thinking through them, with the goal of helping everyone to be safe and successful. Um, so I encourage you to embrace those inconveniences, wearing
Mm,
a mask, doing your campus clear app every day, honestly reporting if you have symptoms, moving to isolation or quarantine as necessary, as part of what is our normal, but the things that are able to keep us functioning. COVID is sneaky, and if we let our guard down, it can ruin the experience.
mm-hmm.
But if we all work together as one big team, as Heidi said, giving each other grace, um, ex- understanding that we'll make mistakes, but correcting those mistakes as best we can and moving on, that we can be a truly successful campus. And we've proved that in the past.
Excellent. Excellent. Wonderful. Well, I want to thank you both again for being here today and helping clear up misinformation. And you are welcome to sit here on the rest of this podcast and hang out as I talk through our mental health moment. But you're also knowing that you're both busy Hartwick people may need to sign off and go. But I just want to say thank you so much for being a part of this. I really appreciate it. And I know that our campus community appreciates it too. So thank you.
Thank you, Heidi.
You're welcome. With that, one of the things we're going to do is we're going to end all of our podcasts with what we're going to call a mental health moment. And today's mental health moment is the whole idea that self-care is not selfish. You must fill your own cup before you can pour into any others. We engage in self-care when we do things that take care of us mentally, physically, and emotionally. And there's no wrong way to do it. Sometimes we're not quite ready to cope with a certain situation. It can almost be too overwhelming. Our emotions can be too heightened. And so one idea is this idea of reducing that heightened state with the strategy of distraction. Now, I'm pretty sure that if you're a college student, you're wondering, what the heck is this health promotion person saying? Distract myself? My professors are telling me to stop being distracted, stop being distracted. But really what we're looking at is this idea to distract our minds away from something that's very overwhelming, to do something that just allows us to calm the mind down, to give it a little mental break, and to allow a very simple, soft shift into thinking of something else. Some great distraction activities can include take a shower, go watch something funny. I know there's some great TikToks out there, and I'm sure you know that too. Taking a mindful minute where you try to describe your surroundings using all five of your senses. Create something, clean something, listen to a podcast. So if Amy or Cam are still there, I wonder if you two have something that you find to be helpful that allows you to distract yourselves every now and then. Um, are either of you still there?
Yeah.
Perfect. Cam, what do you like to do to distract yourself? To
To
take your mind off
distract
things? Yeah.
myself, like I said before, a lot of things I try to do when distracting myself are to try to better myself. Um, so sometimes I like to do small things like just sit in a quiet room and, really be alone with my own thoughts. And I think doing something like that, almost kind of like a meditation thing,
Mm-hmm.
um, I think it's really helpful. It's really calming, and I always walk away from it feeling pretty good about myself.
Excellent. Refreshed. That's a word I like to use too.
Absolutely.
Just a moment. And Amy, I don't know if you're still there.
Yeah, so Heidi, I am still on. I think
Perfect.
journaling
Excellent.
is a great example. Just taking 5 or 10 minutes to reflect on thoughts and ideas, or to work off of a cue or a prompt. Um, the opportunity to kind of keep things in perspective,
Yes.
but also to completely change the subject and journal about something that is refreshing and brings joy.
Excellent. Great suggestions, great strategies. I love it. One of my favorite things to do is to listen to a book on Audible. I feel like once somebody starts telling me a story and I really kind of get sucked into the characters or the description of the setting, really just allows me to take a quick little brain break away from what's going on in the current moment. And I find that in that space, as you both are saying, just that quick shift, change of perspective, just makes it a little bit easier to come back around when it's time and deal with what has to be dealt with. So thank you. Thank you both for sharing that. Well, everyone, this has been episode 1 of the COVID Chronicles for the Wellness and Health Promotion Podcast. We hope you enjoyed the information. And as always, you can email any of us on campus if you have additional questions or thoughts or ideas. And we wish you all a happy and healthy start to J-term and spring semesters here at Hartwick. Until then, take care and be well.